we've got a call.
Oh boy.
You'll never guess where we're going.
Oh, where to now?
The STI Lodge.
Oh, all right. What are we doing?
Looks like the chief complaint is 70-year-old male. He has some rashes, a fever, and increasing confusion.
Oh boy, a rash. That could be an infection.
It could be. What kind of PPE should we wear?
Oh, definitely throw on some, throw a mask and some gloves, and obviously we'll go in with our safety glasses. Anything else you think we should bring, just in case, or?
No, I think that should do it.
All right, sounds good. We'll roll with that.
Okay.
Thank God you guys are here. Come on in.
Yeah, no problem. Sorry, traffic
Comfort
was a
and
bit busy. I was in a real hurry to get here. Where are we going?
That's okay. We're going to my patient Ronald. He hasn't been himself lately. He's been kind of sick. Now he's confused. And his hands, he's got these rashes. I didn't know what to do, so I called you guys. You're the professionals, right?
Yeah, it sounds like you did the right thing. Let's go meet
What
Ronald.
was the confusion noted?
Oh gosh, I don't know. I kind of just started here, so.
Okay,
Yeah.
don't know too much about him then?
Yeah.
All right,
I
fair
can take
enough.
you to him right this way.
Great.
Come on in, guys. Hi, Ron. How you doing?
Oh, good, my dear. How are you today?
I'm good. I'm good. I called these medics. They're gonna come check you out today, okay?
Okay.
You guys need anything from me?
Just in a minute. I'm just gonna introduce myself real quick, okay? Hi, Ron. My name's Leo. I'm a paramedic. This is my friend Kristen here,
Hi.
also a paramedic.
Nice to meet you.
Hi. So I'm just gonna get Kristen here real quick to start a set of vitals on you, and then she's gonna go chat with the nurse afterwards to get a better history of what's going on while you and I chat, and I do a bit of an assessment. Is that okay?
Oh, I suppose you do what you have to do.
Perfect. Thank you. Couple silly questions here right away. So you told me your name is Ronald. Do you know where you are right now?
Oh, I'm at the nursing home.
Okay.
Yeah.
Fair enough. And do you know what's going on right now?
Oh, I don't know. Nurse is in some sort of a kerfuffle about what's going on with me today.
Yeah, fair enough.
Yeah.
And then what kind of led up to us getting called today?
Oh, I don't know. She's seems to be concerned about some such. I don't think it's a big deal.
Yeah, what's the nurse concerned about?
I got these bumps on my hands.
Got some rashes on your hands.
Yeah.
Some nice small round firm bumps there. Does it hurt at all? Any itching or swelling at all?
No, doesn't seem to be.
Doesn't hurt at all, doesn't it? Yeah.
No, not really.
Okay, fair enough. I get you. I'm just gonna start to the top here and ask a few more questions. Are you feeling dizzy? Have a headache at all, or?
Oh, got a bit of a headache, but not too dizzy when I'm sitting down.
Yeah.
Yeah.
Okay. But you get dizzy when you stand up.
Every now and then, yeah.
Is that normal, or?
Oh, well, since I've been on my meds sometimes, but it seems to be getting a little bit worse over the last few days, I think.
Oh, while you're sitting, it's not so bad.
Not so bad, no.
Fair enough.
Ronald, I'm just gonna run this across your forehead. Is that all right?
Oh, you do what you have to do,
All
my
right,
dear.
thank you.
Okay, so I'm noticing a little bit of swelling around your neck here. You having any trouble swallowing?
Oh, well, I had a little bit of a sore throat in the last few days, I think.
Yeah.
Yeah,
Is it okay if I feel and take a look here for a second?
I suppose, young man.
Okay. Yeah, feels like your glands are swollen. Do you want to say off for me real quick?
Ah.
Here, looks nice and red in the back there.
All right, Leo, I've just left your vitals right here. I'm gonna go have a chat with the nurse.
Okay, perfect. So
Okay.
I see your temperature's quite elevated. You have a bit of a fever. How long's that been going on for?
Oh, God, I don't know. You'd have to ask my nurse about that. I'm not quite sure.
Yeah, okay. We'll come back and get a little bit more history on that then, okay?
Okay.
Now, I just want to go forward. You having any trouble breathing? Any exasperations? It's okay when you're sitting, you were saying, right?
Yeah, it's not too bad when I'm sitting down.
Yeah, okay. Is it okay if I take a listen to your lungs real quick?
I suppose.
All right, sounds good. So just nice normal breathing for me. Nice good breath. Again. Perfect. And again. And one more time. Excellent. Well, that's good. I can see that you're breathing a little faster. It looks like a little breathing over 20 rates per minute here, but no difficulty breathing, no dizziness while you're sitting.
No, not so much.
Excellent, sounds good. And then, are you having any nausea today at all or anything?
Oh, I'll tell you the truth, young man, I wasn't able to keep down my beans this morning.
Okay.
Yeah.
Having some beans for breakfast?
Yeah.
And you threw up?
Yeah.
Yeah, anything since?
No, not just a little bit. I've been feeling a little bit sick to my stomach, but
Yeah.
it's about about it.
Has it just been like the fluid in what you're eating, any blood or anything?
No, nothing too concerning there.
Yeah.
I thought the nurse was overstating my symptoms. She worries too much about me, you know, but they're paid to worry, so.
Yeah, no, I get you.
Yeah.
Alright, okay. Now have you been taking anything for the nausea or the fever at all? Any Tylenol or Gravol today?
I don't think so. I just take the pills she gives me.
Yeah, not sure why you just take them, eh?
Yeah.
Okay, fair enough, sounds good. And then I can see the rash on your hands there and a little bit of some scabs on your lips here. Is there any other rashes anywhere else that I'm not seeing?
Well, it's a little bit embarrassing to say, young man, but tell you the truth,
Yeah.
the rash started on my penis.
Okay,
Yeah.
alright, that's okay.
Yeah.
When did it start?
Oh, God. I have a hard time remembering the details, but
Ballpark.
I think it was about a couple of weeks ago I started, maybe a week or two ago, I started to notice some bumps.
Some bumps?
Some bumps and some bumps.
Yeah, on your penis?
Yeah, at first I thought it was just my shingles, but seems to have spread a little bit more than my shingles normally does. So,
Yeah, so it's not not presenting in the past, similar in that sense.
no, not exactly, no.
Gotcha. Is the rash anywhere else or just on the genitals?
Well, it started on my genitals, and then it kind of made its way up to my stomach and on my chest a bit. And then I've been noticing it the last day or two on my hands, and my girlfriend's been noticing it on my face. So, you know.
Yeah, no,
Yeah.
fair enough.
Yeah, they seem to complain a little bit. And the nurse was getting all in a bunch about it, so she thought you guys should be called.
Yeah, it's good to be safe, right?
Yeah.
Okay, so just to get my timelines right here, approximately 2 weeks now, you've noticed a rash on your penis, and over the last couple of days roughly, you've been seeing some progression of the rash into your stomach and on your chest.
Something about, yeah, that sounds about right.
When did it start on the hands? About a couple of days ago as well?
Oh,
or-
yeah, it's starting to get worse over the last day or two.
Yeah, okay.
Yeah.
And so it's just spreading, but no pain, no burning sensations, nothing like that?
No.
Yeah. Do we have any pain or aches anywhere else at all, or?
Well, I got some aches in my joints. I thought that was just my arthritis.
Fair enough. Yeah, okay, but that's about it though?
Yeah, I got the sore throat, I got the lumps and the bumps and the aches and pains. Yeah, a little bit of nausea too.
Yeah, a little bit of headache to go with that?
Yeah.
Okay, fair enough.
Yeah.
Sounds good. So I would like to take a look at the rashes and the possible infection, if that's okay. Just kind of get a gauge of where we're at. And
Okay, well, you do whatever kind of assessment you need to do, young man.
okay, all right. So just I'm gonna look on the chest and the stomach here to compare to the hands here. So I'm gonna expose, and we'll take a look at the chest and the abdomen here. You can see that the rashes are consistent with what I'm seeing on the hands, and there's nice firm bumps, but no itching, no burning sensation.
No.
Excellent. And then, is it okay if we take a look at the source of the infection, of where it started? So, that's okay.
I suppose you do what you have to do, young man. You're a professional.
All right, thank you. I'll make just a quick look to kind of see where we're at, okay?
Okay.
All right, so I'm taking a good examine of the genitals at this time. I can see excessive sores are starting to progress, and that is rashed all over. So that is an indication that that this is an infection that's starting to take over and spreading systemically, so that is a little concern there.
Okay.
Yeah, do you have any burning sensations, or is it difficult to urinate?
No, not really. Not really. No.
Okay, fair enough. All right, and then anything else today? Any numbness or tingling in the hands or feet at all?
No, not too much. Not too much. Not yet, at least.
Yeah, okay, fair enough.
Yeah.
All right. Well, I feel like I've done a decent little head to toe here and got an idea of kind of where we're at. So I'm just gonna confer with my partner and correlate with whatever history and medication she got, so we can kind of develop a good game plan on what to do next, okay?
Okay, well, you do whatever you need to do, young man.
Perfect, thank you. Okay, so I've finished my assessment with Ronald. What do you have?
Well, the nurse gave me quite the lowdown. She says that he's been really, really popular on this floor. He has like 10 girlfriends.
Oh, really?
And apparently he's quite sexually active. So
Okay.
that's definitely an avenue worth exploring. He has a past medical history of hypertension, type 2 diabetes, and also shingles. He's got goals of care designation. He's an R1. He takes metoprolol, metformin, and Valtrex,
Alright.
and he has no known allergies.
Do we know what he takes the Valtrex for?
The shingles, I believe. I think he takes it when he's got an outbreak, but right now they're not really sure, so he's not on it at the moment.
Yeah.
Yeah, what do you think's going on with him?
Well, see, it's interesting that he brought up the shingles there, and that he's got a substantial history of being sexually active with the other residents here, because I was initially concerned about an infection that started on his genitals and is now progressing, and he's got a rash on his abdomen and his stomach.
Yeah.
And then he's got the rash on his hands. I did notice some key unique findings with the rash is that it's not itching and it's painless, but there are some small, round, firm bumps for the rash.
You don't think it
You
could
don't
be
think
like
it's
contact dermatitis? Would that be itchy?
See, it's not. It typically would be more itchy in that presentation. It's not
That's
really.
weird.
The rash isn't really extending along the dermatomes, and then with the history of the shingles as well. Again, he's not really reporting any pain with his rash or anything like that. Just some general like aches to his joints and whatnot. So, in comparison to that, one of the other STIs that I'm concerned about, especially with the substantial sexual activity that you referenced, is that the patient's possibly developed syphilis.
Oh, you know what? That is. I wonder.
Yeah.
This is the STI lodge.
Totally, and we're showing signs of the progression of the infection. He's potentially, his heart rate is being masked by the metoprolol, so I'm querying concerns that he might progress to sepsis on us, and I do recommend we take him in to get some tests done.
Yeah, that would make a lot of sense. Definitely worth exploring.
Yeah. Okay, Ronald, I just finished conferring with my partner there and getting a bit more of a picture painted here. I'm hearing you're quite sexually active with some of the other residents, is that correct?
Oh gosh, well, you know, gotta pass the time somehow, young man.
Yeah, no, fair enough. I do need to double check though. Have you been using protection with these ladies?
Well, you know, back in my day, son, we never really used protection. I'm afraid I still follow that trend nowadays.
Okay, so how often are we having unprotected sex?
Oh, as often as I can.
Often as
Yeah, you know how it is.
Is that daily or?
Oh, at least.
All right, you've been
well,
taking-
I got these little blue pills from the doctor. Let's be going.
Oh, that makes it pretty popular in a
Yeah,
day. All right, fair enough. Well, with that in mind, I am worried about the progression of an STI today.
Oh, I do think it's an STI.
Well, now with how you've been presenting with the progressive rash that originated from your genitals and that you have that trending history that you've been quite sexually active with some of the other residents, they're unprotected. Unfortunately, one of the high risk factors is the development of an STI, which is much more common in our older population. So unfortunately, you are quite at risk in that sense.
Well, if it's an STI, which one do you think it is? I hear that there's a few of them.
Now, I'm initially worried about syphilis having developed for you today.
Syphilis? No. Well, they had one of them lectures about it. They were telling us, don't they said I got to be going blind, and I got to be losing my hearing, and I'd be losing my hair too, and I ain't got none of them.
Which is good things to know, but unfortunately you don't have to have all of the symptoms to be positive for the infection. And if left untreated, we can see it progress to blindness, to deafness, and that hair loss that you're talking about.
And you don't think it's my shingles either?
No, see, typically with that, you're gonna have a different presentation of the rashes. It's gonna be more itching and potentially some more pain over the rashes there as well, but that's not really being presented today. It's not got those nice firm bumps, and it's painless, and it does no itching, which is more indicative of the syphilis.
Okay, well, what do you think is best done for that young man?
Well, unfortunately, I don't have X-ray vision to literally just be able to examine and tell you exactly what's going on. So some of the definitive assessments in the hospital will be to do some blood work
Okay.
to confirm the infection. And then if it is positive, then we can start you on some antibiotics like penicillin to try and combat the infection before it progresses even worse.
Okay.
So with that in mind, I do recommend you come to the hospital with us today, okay? So we can help you with your nausea, like you were saying earlier, and I got some Tylenol for your fever, but with that infection, we do need to run some blood work to get a better idea of exactly what it is, okay?
Okay, well, I guess it's best we don't let it go untreated.
Absolutely.
Yeah.
Okay,
How's it going? What's wrong with him?
well, I finished chatting with Ronald and conferring with my partner from some of the information he gave her, and I am worried that Ronald has progressed and developed an STI today, and that infection is going to get worse. So we're going to take him to the hospital, get some blood work done, and see if we can get on top of this before it gets worse, though. Okay.
Okay.
Now, unfortunately, my partner did tell me that you expressed some concerns that he's been very sexually active with some of the other residents, and that,
About a dozen of them, yeah.
yeah, about a dozen, and that he's been performing unprotected sex, and he said he's been having it, of course, daily. So with that in mind, I do recommend you activate your infectious control protocols and kind of get that chain sequence going, so that way we can figure out who potentially has been exposed, and that some tests can be done, so that way we're making sure that no further infections are developing, okay?
Okay, I'll try to round them all up, let them know, and I'll chat with our doctor here.
Excellent, thank you so much.
Thank you for your help.